or can surgery be done for all patients?
Yes, this is very important question because it is very important to understand that when to go for surgery.
Hey guys, and welcome back to our third video on vitiligo. We still have Dr. Girish Shah, founder director at Skinzone. Today we'll be speaking about something very interesting in vitiligo that has really come up in a big way in the last decade or so, which is surgeries for vitiligo. Here at Skinzone, Dr. Girish Shah has been doing surgeries for vitiligo for a long time. He has been one of the pioneers for what are called as cellular grafts in vitiligo, which he started way back in 2001.
It was not before that. Even in 1997 we did our first cellular graft.
Yeah, so first cellular grafts in 1997. So this is something that is a very unique thing, something from modern science, because of just the research that has gone into vitiligo and cellular grafting that we can do. So coming to first of all, who are the real candidates for whom surgery is an option? Which vitiligo patients for whom surgery is an option, or can surgery be done for all patients?
Yes, this is very important question because it is very important to understand that when to go for surgery. Now we call this as a stable vitiligo. In my previous talk also I said that there is something called stability in vitiligo. That when patches are not growing in size, when there are no appearance of new patches for at least 6 to 12 months. And not only that, even with treatment these patches are not improving, then we call this as stable. So there is no increase in the size of the patch, no increase in number of patch, or neither they are improving. And if they are localized, means say for example there are few patches on the skin and they are localized, then we will consider taking them for the surgery. Even if they have little larger area involving about 300, 400, 500 square centimeters, then also we will consider them for vitiligo surgeries. But those who have extensive vitiligo or where vitiligo is involving more than 10-20% of body surface areas, then I don't think they are real candidate for surgeries.
So then these vitiligo patients who are actual candidates for surgery, is there a single surgery in vitiligo that you do, or are there different types of surgeries? So last video you enumerated many surgeries. So what are the surgeries that are available for a patient with vitiligo, and how do you decide which surgery to do when? Because you do all surgeries. So when do you decide that I need to do this surgery or you need to do the other type? So can you get us through as to what are the different types of surgeries and what are the advantages of each of them?
Yeah. Now see, to tell you what surgeries and how these surgeries got evaluated. Then initially these surgeries were done only by the plastic surgeons in the form of skin grafts. When there are few patches of vitiligo, somebody wants to hide these patches of vitiligo, especially just before their engagement or wedding, or when their marital proposals come, they want immediate results. So they underwent some skin grafting procedures and immediately they got the results, and at least their social problem were solved. Only problem was the cosmetic results were not so good, especially on the face or the exposed areas of the body. One could immediately make out that these are some operative procedure done. Certain areas it was little difficult to do this skin grafting. So we devised something. There was further development, and that is development of punch grafting, where we will put the grafts measuring about 2 to 3 millimeter in size. Results obtained were good, but again cosmetic results were not that appealing. So we developed what is known as mini punch graft, where grafts were very small in size, about 1 millimeter in size. Results were good, but it is very tedious and it is practically impossible to cover the large areas. Second thing, on the face, none of these procedures were cosmetically acceptable. So for small patches, we developed a procedure known as blister grafts. Thereby we create some blisters by some mechanical means on the thighs or buttock area. Take the superficial graft and then put this on the vitiliginous areas. Now here cosmetic results were excellent and success rate was very high. Only drawback was it could cover only small areas measuring about 2 to 3 inches in size, not bigger than that. So these all these procedures were known as tissue grafts because we are putting the tissues in that.
Okay. So first of all, even for a normal person, what actually is a graft? What do you mean by a graft? When you say a graft, what do you mean by that?
Now when we see in skin we have different layers. Upper layer is epidermis and lower layer is dermis. Now when we remove, and these melanocytes are present at the junction of epidermis and dermis. So in skin grafting, you remove the surgically upper layers of the skin, that is full thickness, full or layer of epidermis and very upper thin layer of dermis. Take this entire layer piece of the skin and then remove the skin above the vitiligo patch and put this new skin over there. This is known as graft. When you make this graft small in size, they are known as punch graft. Now, when we make this graft in the form of blister, with the help of blisters, they are very superficial grafts, contain only full thickness skin and no dermis at all. And that is why results obtained were excellent. Now what we do, that we take very superficial skin grafts under local anesthesia, process these grafts in the laboratory, separate the cells which are present in the epidermis. So it contains this epidermal cells and also the melanocytes. We concentrate this solution, cellular mixture, and then transfer it to the white patches after removal of the surface epidermis, and then put a dressing. Now advantage is that here we require very small area of the graft from other normal part of the body, that is donor part. The size of the graft can be 1/4 to 1/5 of the size to be covered vitiligo patch. Second thing, cosmetically very elegant results were obtained. It is practically impossible for someone to say that this person has undergone any kind of surgery. And third thing, it allows you to cover large areas in a single sitting. We can cover about 300 and 400 square centimeters in one go. We can treat either one big large patch at a time or multiple large small or medium sized patches at a time. Downtime is hardly any. And another advantage of this cellular graft is that the donor site, that is the site from where the normal skin is taken, also does not develop any scarring. There is temporary skin color changes, and over a period of 6 to 8 months, this color can go back to normal. And that is the major advantage of these cellular grafts over the regular skin grafts.
Okay, so basically it's more of better cosmesis, lesser downtime. The results, when can the patients expect the results of these cellular grafts?
Yes, this is very important. That in cellular grafts, once we remove the dressing, you will see that presence of white patches as they were prior to treatment. It is not like your regular grafts where when you remove the dressing, the skin color becomes normal. But here it takes it. What happens after this surgery? The melanocyte cells are settled in the white patches and they start producing the normal color in the skin. And on an average, it takes about 2 to 3 months to show the skin color. But on areas like hands and feet, it may take anything between 3 to 4 months or little longer.
So basically it requires patience. You need to come in for these surgeries. If you have a particular function where you want the results to be seen, then you need to come in at least 6 months to 8 months prior to that for us to really give good results. So that is about the surgeries that are there with vitiligo. You want to add anything?
I want to say one very important thing, a very important message for the people. We find that whenever patient has stable patches of vitiligo, and surgically they are very much fit and likely to get good results. But most of the time patients they want to delay the surgery. They keep saying that doctor ने आपसे medicine दो naturally ठीक करना है. And only when they have some emergency like some family function, some marital this, they come to us for the treatment. And we do not have enough time to give them the best possible treatment which can give them the best possible cosmetic outcome. So they should not wait. There is nothing like natural healing and natural development of the colors.
Okay.
So it is best thing that if they have stable vitiligo and if their dermatologist is suggesting that yes, this is the right time to undertake surgery, better go for it. It is always advisable.
Okay, so quite important to know, trust your doctor, trust your dermatologist because he's an expert in it, rather than listening to other advices from society. The surgeries are quite simple. They are done under local anesthesia. The risk associated with these surgeries is very minimal, if any. And as I said, trust your doctor. So these are about the surgeries that we have in vitiligo. In these 3 videos in this series, I would like to thank Dr. Girish Shah. He has covered almost everything that a patient needs to know about vitiligo. We have a 4th video in this series that we'll be putting up about the entire surgery that is known as keratinocyte melanocyte transfer. That is the cellular grafting that the doctor was talking about. It is going to be a very technical video. So if you're someone who likes to see these technical videos of how a surgery is done, you can go check this out. Dermatologists, young dermatologists will definitely love this video because this has the nitty-gritty of how the surgery is done. We'll be explaining everything in detail, including the instruments that you would require. So for dermatologists especially, go check out the 4th video.